Okay. What is the most likely diagnosis in this patient? Multiple myeloma, chronic lymphocytic leukemia, CLL, Waldenstrom macroglobulinemia, non-Hodgkin lymphoma, or Hodgkin lymphoma. A 68-year-old man presents to the primary care physician with complaints of fatigue, weight loss, and generalized weakness. On physical examination, he reports hepatosplenomegaly and lymphadenopathy. Laboratory tests reveal anemia, a high serum protein level, and an increased ESR. Serum protein electrophoresis shows a monoclonal spike in the gamma region. Further workup reveals that the presence of IgM monoclonal protein and infiltration of bone marrow with lymphoplasmacytic cells. Which of the following is the most likely diagnosis? Okay, seeing multiple myeloma and Waldenstrom microglobulinemia. I know those are both the monoclonal spikes in the gamma region, and to me, it's between one of these two. Um, that's kind of what I'm going with. And I know that there's a difference between IgG and IgM. I honestly don't remember 100%, but I'm gonna end up picking Waldenstrom because multiple myeloma, they would usually talk about, it's usually I think it's already in a woman most of the time. I think that you're gonna have like hypercalcemia, you're gonna have renal issues, you're gonna have bone pain. Um, you're going to have lytic lesions of the bone. And so I feel like they would at least try to talk about something else here. They talk about hepatosplenomegaly, lymphadenopathy, high serum protein level. I guess that could indicate renal issues if it's like albumin, but
Okay. So talk to me about this, right? So you got it between two. Okay. So now you want to talk about a clinical standpoint, right? Older person, fatigue, weight loss, generalized weakness, hepatosplenomegaly with lymphadenopathy, anemia, high protein, increased ESR, monoclonal spike in the gamma region, IgM, and infiltration of bone marrow with lymphoplasmacytic cells. Does that sound to you like it's benign or malignant?
monoclonal protein and infiltration of the bone marrow with lymphoplasmacytic cells. That sounds more malignant to me.
Okay, is Waldenstrom macroglobulinemia, is that malignant or benign?
I think it's benign.
Okay, multiple myeloma, malignant or benign?
I think it's malignant.
Okay, what do you want to go with?
Let's go with multiple myeloma.
Okay.
Oh, it's so frustrating.
Okay, so
Oh,
let's look at this together. Okay, I would have gone with multiple myeloma actually. So let me see if this answer is correct here. Patient's fatigue, generalized increased monoclonal gamma read IgM, bone marrow lymph all consists of this, lympho characterized with monoclonal infiltrate, multiple myeloma. Oh, it's mostly IgG or IgA, typically presents with bone pain,
yeah,
renal,
it's
etc.
yeah.
But let me take a look because I want to make sure that Waldenstrom macroglobulinemia, does it cause systemic issues like that? I didn't know that it did. I know that it was IgM because it causes you thick blood. Do you remember that in Waldenstrom's macroglobulinemia? It increases
Causes
your
thick
risk of
blood.
clots. But let's learn together here kind of what it is here because I always forget. Waldenstrom macroglobulinemia symptoms.
Yeah, it says overproduction of IgM, and it says lymphadenopathy, hepatosplenomegaly, hyperviscosity.
Okay, so I guess it does. And macroglobulinemia is uncommon. Oh, so it is malignant. Okay, so that's the thing. Okay, so it is considered right a form of malignant B cells. So that's something that we missed together. Okay.
Oh, okay, malignant B cells.
Okay. So just make sure you kind of remember that it's not benign. So that's the thing that kind of changed our answer, right? So if we thought this was benign together, which I also thought was benign, right? This is also malignant acting. And so the thing that differentiate this answer is actually going to be the IgM. Multiple myeloma is usually IgA. So that's going to be your best answer is actually C. So I actually veered you probably the wrong direction there, but we learned together though.
No worries. I'm not going to forget that again.
Perfect. Perfect.